Hello. In this video, we'll talk about what to do if you have concerns about your memory or cognitive functioning, who to go see, and what questions to ask or what to ask for. At the end, I'll share a free resource you can use at your doctor's office. Many people wonder what they should do if they have concerns about their cognitive functioning or memory. One important step is to go to your primary care doctor and have a conversation with them about your concerns. You can ask for a physical and basic lab work that can be used to identify and help your provider treat common causes of cognitive problems that can be reversible. Many providers, especially geriatricians or primary care providers who are familiar with the aging process, will know exactly what to do. Some doctors may be less familiar with what to do in this situation. If that's your case, you can direct them to this video or use the information in it to prepare yourself for the conversation. Your provider may wish to do blood work to rule out common causes of cognitive problems, like deficiencies in thyroid functioning, vitamin B12, vitamin D, or folate. They may also want to do a urinalysis, or UA, to check to see whether or not you have a urinary tract infection, sometimes called a UTI. UTIs can be bothersome and uncomfortable at every age, but as we get older, they can be especially damaging. They can cause problems with delirium or behavioral or other cognitive issues that make a person look so impaired they may be confused as having dementia. Your doctor may also want to have a conversation about your sleep, because having an undiagnosed and untreated sleep disorder, something like sleep apnea or restless leg syndrome, can cause problems for your entire body, but it can also cause significant problems for cognitive functioning. Other relevant topics might include things like substance use and your mood or emotional functioning to understand aspects of your life like stress, depression, or anxiety. Many of these issues can be successfully diagnosed and treated. When the issues are corrected, brain functioning can return to normal. I've seen numerous patients where treating these issues can cause miraculous changes and improvements in cognitive functioning. If these issues have been ruled out or treated, but you still continue to have cognitive problems or worries about this domain, your provider might then talk to you about referrals to other treatment specialists. It may be helpful to see a neurologist who could do a thorough neurological exam and potentially order brain imaging. You may also be referred to see a neuropsychologist or psychologist who specializes in cognitive assessment to understand the function of your brain. When you have concerns about your memory or other cognitive functions, the bottom line is don't worry alone. In order to make this easier, I'm sharing a free checklist that you can print off and bring to your doctor's office to facilitate the discussion. It's in the link below. This video helps you understand how to talk to your primary care provider about worries about your memory or cognitive functioning. If you don't have a great primary care doctor, come back next week where I'm going to dive into the topic of how to pick a great primary care provider or geriatrician. If you have a great primary care doctor, but you're confused about all the different medical specialties related to brain health and want to get the scoop on what each one does, I'm making a video for that, where we'll go through their titles and what role they play in helping you have great brain health. Thanks for coming today. I can't wait to see you in the next video.